Hello everyone. Welcome once again to a new case in the series of how to treat certain diseases in pregnancies. First of all, today we will be going to discuss how to treat anemia in pregnancy. So let us start the case. So a pregnant lady comes to your OPD or she is at the ward and you have been called for a consultation regarding management of such a patient. So you found that she has fatigue, she has exertional dyspnea and pallor, so it shows the patient might have anemia. And then when you have physical examination, you found to have glossitis and koilonchia. So after this, you did the test. The next step is doing a CBC. So the hemoglobin is 10.6. It shows the patient has anemia, but which anemia we need to check for the MCV. So the MCV is less than 80, it shows microcytic anemia. And hematocrit is also low, so it means the patient has microcytic anemia. In peripheral smear you did, it shows hypochromic and microcytic features. So most likely is iron deficiency anemia. So iron studies have been done and it showed to be serum iron reduced and serum ferritin is reduced. It is the typical feature of iron deficiency anemia, and TIBC is increased. So it shows that the patient have features of iron deficiency anemia. So how would you, what is the diagnosis and how would you manage such patient? So before going into detail of how to manage the patient, we need to have some tips regarding how to manage and what are the points. The pregnant lady usually develops physiologic anemia due to hemodilution, as there is an increase in plasma volume. So you would see a normocytic mild anemia. So if you found normocytic mild anemia, you don't need to treat the patient. But if on the other hand you see the MCV less than 75 or more than 100 in a pregnant lady, you need to manage this patient because it indicates a pathology. Because in contrast, we know that microcytic and macrocytic anemias, in contrast to normocytic mild anemia, requires treatment, and normocytic mild anemia do not require additional evaluation and management. So whenever you see on CBC microcytic or macrocytic anemia, you need to manage patient. So the next will be iron deficiency anemia definition. So what is the cut points? Depends, but most likely if the patient, pregnant lady, have hemoglobin concentrations of less than 110 gram per liter, 11 milligram in the first trimester, or it is less than 105 in the second and third trimester of pregnancy, and less than 100 gram postpartum. So it shows the patient has iron deficiency anemia, so you need to treat her. So how would you treat? Such guidelines are there. You need to give patient 180 to 200 mg iron supplement given twice daily till the blood parameters like hemoglobin, hematocrit, MCV become normal, and then you need to give once daily the medication as a maintenance dose, which should be continued throughout pregnancy and for 3 months after replenishing these stores. So after 3 months you need to check the CBC and hopefully it would be recovered. So the management which we usually give is first we need to treat the etiology. We want to know what is the etiology, what are the certain etiologies which have caused this decreased absorption, decreased intake, there's some gut pathology, or there's some infection or ongoing bleeding. So we need to manage the etiology first. Then in iron we have a choice of giving orally and IV. In orally, we need to give the patient tablet ferrous sulfate 150 mg or 180 depending on the institution you are there, and the folic acid and B complex should be added. BD As we said that first we will give BD until the blood parameters become normal, and after maintenance dose for almost 3 months. And we can give patient tablet vitamin C OD for better absorption of iron, as iron is better absorbed while vitamin C is there. In IV, if the iron is quite low, so we can give the patient safely ferric sucrose, that is 100 to 200 mg diluted in 100 ml, 0.9% normal saline, and it is infused quite rapidly over 15 minutes. Total 3 doses are being given on alternate days or on every other day. And diet, we recommend the diet for recommended diet for better absorption of iron. Any diets which have better absorption of iron should be given for the better results. So this was a short case of anemia, how to manage iron deficiency anemia, one of the commonest anemia worldwide. And I hope you have learned something. Please like my channel and subscribe it. Hope to see you in future lectures. Thank you for your attention. Thank you so much. Goodbye.